So now what, Dr. Double Meat Patty?
Why is it called Dr. Double Meat Patty? Ed, Edd, and Eddy. Like any boy trying to survive their adolescence, they are sometimes clueless when it comes to standard everyday health and wellness protocols. That's why today we're going to be reacting to and breaking down all of the hilarious and insane medical type situations from the Cartoon Network classic. All right, let's dive right in.
The lackadaisy cathro disease.
What type of disease? Lackadaisic cathro disease. Yeah, I don't think that is a diagnosis or a disease, but it's really interesting. Okay, this brings up a really good point. In medical school, this happens all the time. It's actually called medical student syndrome, where you're studying all these different disease processes and you actually manifest these symptoms as you learn about them, even though you actually don't have any of these disease processes.
I'm so unwell. Tell me the truth, doctor. How long am I for this world?
To lunch?
The lunch, I love it. So yeah, sometimes people can be very dramatic, but it's very interesting, and a phenomenon that I see a lot is when somebody actually comes to the ER, all of a sudden they just decompensate really, really fast. When they get to the hospital, it's almost like the body relaxes a little bit, and that's when bad things typically happen. Bunny rabbits, oh my gosh. You gotta be careful with animals. Sometimes you can be allergic to them. There are some animals that if you touch actually harbor other diseases. Salmonella is carried by turtles. That's one example, there's many. Just be careful with animals and know what potential diseases they may carry.
I sneezed. I'm mutated!
He's itchy, he's swollen, he has a rash, he had itchy eyes, watery eyes. Looks like it's an allergic reaction. Typically, allergic reaction, you're not gonna blow up like a balloon, but you actually will swell. We see people's faces swell up, anaphylactic reactions, and basically you gotta get epinephrine on board in those circumstances.
Eddie?
What, are we done?
So this guy looks like the girl that turns into a blueberry in Willy Wonka, if anybody knows what I'm talking about. I've never seen anybody turn that kind of like swollen, but I've seen people turn almost purple. These things do happen. They just don't float in the air. What is this?
Flashlight, please.
No.
Clothes, please. Lights, please, nurse.
What?
Lights, please.
Okay, wait a minute. I was like, okay, good attempt. We got good bones everywhere. And then for some reason, he has some sort of bone in his forehead. I don't know what that is. Well, at least we got ribs and we got a pelvis.
Just one more test.
Oh, look, it's a bun.
You appear to be allergic to rabbits, Ed.
So now what, Dr. Double Meat Patty?
Why is it called Dr. Double Meat Patty? I don't understand that. Let me know if you guys can reference what that means.
More cold cream, Eddie.
Cold
Coming
cream.
right up, Dr.
All right.
How come I'm still big, guys?
Ice should reduce the swelling.
So ice could help in a situation when you're really swollen because it actually decreases blood flow to the area. It doesn't happen instantaneously. It takes a little bit of time. A lot of times people will come to the emergency department and they're swollen. They're like, can you please just stick a needle in me and get the swelling out? And it doesn't work that way. All right, at least we're like cleaning. Typically, you're using sterile solutions or you're using like an autoclave, which is a specific temperature to actually sterilize something when it typically comes to reusable things.
Gee, nice head, Ed.
Oh my god. Oh my gosh. Obviously, you could do that in real life using a blood pressure cuff to squeeze your own head. I will tell you how many patients get so pissed off when there's a blood pressure cuff on their arm. Your normal blood pressure should be like 120 over 80, 120 over 70, 120 over 60, anything like that. A lot of repercussions for having high blood pressure, so you want actually to keep it under control.
Knock yourself
Oh
out.
my gosh, release the pressure.
But it's Whopper Wiener Wednesday in the cab. Whopper Wiener Wednesday, Double D!
Eddie, a poor
Using massive cotton swabs. What the heck? We actually have different types of cotton swabs. We're professionals. We're not sticking them in our ears. I've had to remove lots of different cotton tips that get stuck in the external auditory canal of your ear because you're digging too far in.
A poor self-image hath he that envies his fellow man's accolades.
Forget Acapulco.
I love Acapulco. Who wants to go to Acapulco? That's a place.
Eddie, no! You can't read this! That's Kevin's personal personal file.
Oh no, so bad news bears. You can't actually look at people's medical records. That's against the law. The only people who have access to them are the people taking care of you. Your medical records are confidential. Oh,
I feel hot.
we got a fever.
Oh, let me soothe you. Thank you, Jimmy.
Oh, that's disgusting. Well, I wonder why the baby sister is sick after the big brother just put all the schmutz from his mouth everywhere. Our mouths are one of the dirtiest places. That's why it's nice when somebody's wearing a mask to prevent all that stuff being spread to somebody else.
Well,
And
your pulse
perfect
is
example, the other Eddie is wearing a mask. So typically if somebody is having a fever, they're gonna be tachycardic or having an elevated pulse. It basically means as your temperature is rising, your heart rate's beating faster as well.
Yeah, mister, I wish I was a smart pants.
Your temperature seems normal as well. Ow, what do you know?
They're trying to catch her. I'm trying to probably get out of school or pretend that she's sick. It's really hard to make your internal temperature falsely elevated. The best temperature is an internal temperature, which unfortunately is a rectal temperature.
Gentlemen, I suggest we leave, as a cold at any grade can be quite contagious. Yeah, get lost!
I will show them the door, dear debilitated one.
There are many different types of viruses out there that cause the common cold. When somebody refers to a common cold, we're referring to a common viral illness. Influenza, parainfluenza, coronavirus, respiratory syncytial virus. There's a ton of viruses that have been around long enough that they've degraded, so to speak, to where they're not severely deadly or dangerous. There's all levels of how a virus affects our bodies. Don't do that, that's really funny.
What a sap! We're wasting the whole day.
Ed's just fulfilling his duty as a caring brother, Eddie.
Nice. Don't use a vacuum at home. If you guys have seen my Big Mouth episode, he used a vacuum for a whole different thing. But at the hospital, we do sometimes use suction. We have these different suction canisters. Actually, you don't want to suck for too long because then you're depriving somebody of oxygen. So typically no more than 10 seconds. You want to hold your own breath while you're doing it to know when you need to breathe to allow the other person to breathe. And if you guys like this video, check out these episodes in my doctor reaction series. And as always, make sure you subscribe, turn your bell notifications on, hit the like button. Thank you so much for watching and stay healthy, my friends.